Yeah, just a quick review of the WonderCare Bamboo Knee Compression Sleeve. So this sleeve is made specifically for people who have some type of knee problem or having knee pain. And the idea is that you put on the sleeve and it supports the joint, the surrounding soft tissues, like the muscles around the joint. And it restricts your motion a little bit. So that way your knee has a chance to rest, recover, and doesn't get so overstressed as you're doing things. So a few points about this particular sleeve. It does provide mild compression, so this isn't any kind of heavy duty support. It doesn't have hinges. There isn't anything really rigid, running along the side or anything. So basically, you're going to use this if you want like mild compression. It is made of cotton, latex, and bamboo yarn, so it's good to know exactly what it's made out of. So yeah, if there's other things you can do for your knee pain, bulletproof your knee, this is where I'm getting this stuff from. If you have any kind of knee problem, make sure that you're doing at least one exercise for your quadriceps muscle. Your quadriceps muscle is a big muscle on the top of your thigh here. So here's your kneecap or your patella for reference. So right above that is your quadriceps muscle. It's actually made of 4 different muscles, but collectively it's called the quads or the quadriceps. So what they're finding now, the research, when researchers go out to and they look at people with various knee problems, basically just about any kind of knee problem you can have, they find that you have a problem with your quadriceps muscle, meaning that's either weaker than normal, or if they do like a CT scan, they look at cross-sectional area, it's usually weaker than normal. So a few things like knee swelling in the quadriceps. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So if you have any kind of acute or chronic long-term swelling, chances are your quadriceps have kind of taken a hit. Knee injuries in the quadriceps, like fractured your tibia, your lower leg bone, surgical opening of the knee joint. If you had knee surgery before, puts you at risk for having decreased quadriceps strength. Now, the quadriceps muscle is a big stabilizer of your knee. So if you're knocking that strength down, you're just not getting good knee stability. It's hard to get better and get pain-free unless you get that stability back. Ligament problems in the quadriceps, anterior cruciate ligament. So for instance, one study looked at people who completely ruptured their ACL. Researchers found the strength of the quadriceps muscle in the injured leg was decreased by 25 to 30%. None of the other muscles around the knee, just the quadriceps was decreased that much. So here again, like I said, it's a main stabilizer. So 25 to 30%, you're knocking down the stability of your knee 25 to 30% over a quarter. That's a lot. The posterior cruciate ligament, same thing. Medial collateral ligament, tear these ligaments, you start having problems with your quads as well. Knee pain in the quadriceps. They're showing that if you have like long-term knee pain, you probably have decreased quadriceps strength. Here's a good one: knee arthritis in the quadriceps. So if you Google like knee arthritis and quadriceps, you're going to find it's very, very consistent in the literature that if you have knee arthritis, more than likely you also have decreased quadriceps strength, and that's just what they find. Likewise, there are randomized controlled trials showing that if you have take a group of people with knee arthritis and you strengthen just their quads, your knee pain starts to go away. And other findings, they've also found that the people with the stronger quads with knee arthritis have the least progression of their knee arthritis. So it actually kind of interrupts the pathological process, so it doesn't, progress so much. Patellofemoral pain. So, the list goes on and on. Any kind of knee problem, even just knee pain, a little bit of swelling, at least do one exercise for your quads. Fine-tune control over your knee. Here I think they're mainly talking about the hip muscles. So sometimes your knee can be killing you and have a lot of pain, but there's absolutely nothing wrong with your knee. The problem is up here at the hip. Okay, so classic cases like iliotibial band syndrome. You take a group of people with iliotibial band syndrome and you get testing their muscles around their hip. They find your hip abductors are unusually weak. That keeps your pelvis level as you're walking and brings your leg out to the side. Likewise, here again, like with knee arthritis, take a group of people with iliotibial band syndrome and you strengthen their hip abductors. Iliotibial band syndrome starts going away. So a lot of interaction there. Let's see, increase optimized knee flexibility. Well, we all know we need a knee that bends and straightens fully. But what a lot of people don't know is that your knee doesn't just bend and straighten, it also rotates. About the last 10 to 15 degrees of you straightening your leg out or full extension, your knee actually rotates laterally. So that's an accessory motion that your knee has to have for full functioning. And here's a little test to see if you have that. And you can get that back by doing certain stretches. Other things you can do, increase dynamic knee stability. Here they're talking about proprioception. So proprioception is your position sense. So if I suddenly turn off the lights, you'd be able to tell me whether your knee was bent or straight. And that's because of your proprioception. You have joint receptors and you have little receptors in your knee muscles. and they're giving your brain constant feedback as to where your knee is in space. And that way, you always know where your knee is. What they're finding when they start looking at people with various knee problems, that their proprioception is really decreased. It's not like they don't know where their knee is, but they just find it's not what it should be. And that's something that you could improve upon. But yeah, lots of stuff you can do. But hey, nothing's as quick as putting on a sleeve. A lot of people report they get instant pain relief. So this is a good one. Check it out.